I'm Dr. M. Srinivasa Rao. I'm a consultant cardiologist, intervention cardiologist. Weight is one of the important factors that we need to check in order to have a heart-healthy life. Obesity is one of the risk factors for the development of cardiovascular diseases. In fact, there was an interesting article published in 2015 in American College of Cardiology journal, where they said that globally about 14 million deaths occurred because of obesity. And then this 14 million deaths, most of the things because of the heart disease. That means there's a direct relationship between obesity and the heart disease. If you maintain a proper weight, you can actually prevent heart disease. Obesity is a new curse in India. We are the third most obese country in the world after United States, China. And obesity is, since it is a risk factor for the development of cardiovascular disease, it also increases the risk of developing hypertension, diabetes, heart failure, and also coronary disease. We need to check our weight and try to adopt a lifestyle where we reduce our weight. Number one, for the weight reduction, most important thing is the calorie intake. That's most important. Reduce the calories. Avoid foods which are high in calories, like fats, refined carbohydrates. Adapt to a much better diet like fiber-rich diet, vegetables, etc. At the same time, one need to also exercise. Exercise is also second important factor to reduce the weight. And third thing is avoid stress. Stress also promotes weight gain. To avoid the stress, we require adaptation to stress in our environment, number one. Don't overact those kind of factors which induce stress in among our life. And the third thing is when we have to avoid stress, we need to also relax. Relaxation is extremely important. About 7 to 8 hours of sleep is all that is required to have a better what we call de-stressing. Then meditation also extremely important. Before we actually resort to any drug therapy for the patients to reduce the weight, most important thing is to follow the lifestyle, as I said, and of course dietary counseling and also some psychotherapy for the people. It will go in a long way in reducing the weight. Only in those patients who are not able to reduce the weight, we need to try to give them some drugs. Fortunately, we have now a safer drug profile which is coming into existence, but there would be a second in line, not the first in line. While a BMI is a very good predictor of bad outcomes, well, in India we have a peculiarity, what we call is a lean fat that we call. What we that is when our people have got tendency to have a abdominal obesity. Even one doesn't have a high BMI, which actually puts them into a overweight or obesity. But if one has a high waist girth or waist to hip ratio which is abnormal, then those are the people who have much more higher risk. In fact, the chances of one having cardiovascular risk is much more if one has high abdominal fat content, which actually reflects the abdominal girth being more. So that's where we need to project in Indians actually. It's called thin weight individuals, which are who have not necessarily have BMI high, but they have a high waist circumference. Any fluctuations in this kind of kind of drastic reduction in the weight and again putting back again the weight into the previous level, it is not a good thing to happen. I think one should have a maintenance of a lifestyle in such a way that maintain the weight in the right proportion, and right way of what we call maintain the weight is very important, rather than doing some crash course and again stopping that kind of a lifestyle which led them to lose weight and again getting back the weight is bad. That should not be there. We as Indians, we have a high risk of developing cardiovascular disease. So we have a bad genes And when the bad genes are coupled with bad environment and lifestyle, we have a high risk of developing heart disease. We have 20 times more incidence of heart disease in India compared to Japanese, and 5 times more than Chinese. So this reflects that we need to be very careful. Any risk factor we have within us is going to harm us much more than any other race in the world. So maintain a healthy lifestyle, number one. Avoid smoking, avoid stress, maintain a proper weight, relax well, avoid stress. If you have a diabetes, get your diabetes under control. If you have high blood pressure, get your blood pressure under control to optimal level. And if you have cholesterol high, get them to the normal ranges. This will actually make you healthy and avoid development of cardiovascular disease in future.